Okay, great. So I'm Michaeleen Doucleff. Actually got promoted recently. I'm a correspondent at NPR. I'm on the Goats and Soda team, as Stephanie mentioned, and I just want to tell you a little bit about that and like what that is. So NPR has been funded by the Gates Foundation to cover global health for 6 years. I've been on that original team starting then, but 4 years ago they gave us a giant infusion of money to build a really big team. And so we now have about 7 or 8 people that are devoted solely to global health and development, including reporters, editors, and a few visual people. And our stated goal publicly and from the Gates Foundation is to get people to care. So to get the Americans, like Karen said, most people care about what's happening on U.S. soil to Americans. And the Gates Foundation wants people to care more about people all the way around the world, people that are like, I like to say, like Black and brown people around the world that are far away. And so we've thought very carefully about how to do this because it's hard. It's a really hard mandate. But what we've tried to do is make it very personal, bring people's personal stories to stories that you usually just hear numbers about, like poverty and tuberculosis and things that Americans don't relate to very well. We try to make them relatable through people's stories, as well as through like quirky science, quirky ideas. So we have these, I kind of call, we put the spinach inside the cake. So we have this cake around what we think of as some type of lesson or something that's valuable for Americans. We're kind of getting them to read. For me as a scientist, and for me specifically, I focus a lot on infectious diseases. So I was trained as a biophysicist. And for me, I love what I do. I love getting people excited about infectious diseases and pathogens. And for me, waking up every morning and just, I'm excited to learn like what's new in science, what's going to be the new disease that's going to pop up, or the new trick that the disease is doing to subdue our immune systems. I just get super excited about that. But the challenges on that front is to present it in a way that gets people intrigued and interested, but not afraid. And so we work really hard to try to balance this, right? Like, if nobody reads your story, then it can't really do anything. But at the same time, we don't want to present a very hot and heated topic like an Ebola outbreak in a way that causes fear or increases controversy. And so a lot of times what we'll do is we'll actually do the opposite, is we'll take the stories that are causing fear and alarmism, and we will look at the numbers and look at the data and try to debunk that or bring it back down to earth and say, like, well, what really does what does the data say? So for instance, during the Ebola outbreak in 2014-15, when Ebola came to the US, there was like hysteria on many levels. And one of the stories that I wrote was called, "So Seriously, How Contagious is Ebola?" And what I did was actually just describe what the R naught is of a virus, of a disease, and then looked at like, well, what's Ebola's and how does that compare to, say, measles or HIV? And it was an incredibly popular post. I think it ended up having like 2 million views and being like one of the most popular posts at NPR that year. But it was seriously that simple. It was like seriously just taking one simple idea in epidemiology and making a whole story around it and really informing the public, like, hey, here's why we don't need to be so crazy, and we can think about this in a really reasonable way. But engagement is a really hard thing for us. I can give you some idea of like our story numbers. In general, a straight global health development story will probably get something like 10,000 views, maybe more. That's why we work really hard to try to package it in a way, tell it in a way that brings more people in, because we can't make a living with 10,000 views. And it's just, what's the point of that, right? Like, we really are here to try to provide high quality information to the general public. And 10,000 views, we don't see that as doing our job. So sometimes we get criticized at Goats and Sodas for maybe being too gimmicky, maybe portraying things in a way that other people don't really agree with. But I think what we say is that we're really trying to humanize the topics. We're really trying to present them in new ways to draw people in and make and get people um, not only interested but appreciative of other cultures.